Welcome back to the Heal Your Hormones podcast. I'm your host, Dr. Danielle, and today's topic was a specific request from a listener, and that is uterine polyps. So I want to cover today, one, what are uterine polyps? How do they differ from fibroids? What can cause polyps? Why should we worry about them or care about them? And then both what can be done from a conventional standpoint with your OB for your polyps and what can be done from a naturopathic standpoint to help prevent polyps. So let me just start with uterine fibroids. You may have heard of these because they tend to be more common in younger women, but fibroids are made from smooth muscle coming from the wall of the uterus, and essentially they are benign growths within the uterus. 80% of women in their reproductive years will have some fibroids at some point. However, oftentimes fibroids don't cause any symptoms, so they go undiagnosed and unnoticed. The exact cause of fibroids is unknown, but it's predicted that it's related to higher estrogen levels, triggering the growth of a fibroid. Fibroids can really occur at any age, and they range in size from very small to the size of a grapefruit, so they can really take up a large portion of your uterus. Now, on the flip side of that, polyps are an overgrowth of the endometrial tissue that is not shed during your period. So fibroids are the muscular structure of the uterus that is starting to kind of grow and protrude out. Polyps is really that endometrial tissue that lines the uterus. It's that endometrial tissue that grows each month. And then when we get our period, that tissue breaks down and is shed and we get our period. So polyps is essentially when that tissue starts to overgrow, but then it's not shed during the period. Polyps most often occur during the perimenopausal time period. So from like 40 to 50 years old. It is possible to have them younger, but we most often see them a little bit older compared to fibroids that really happen at any age. And like fibroids, polyps can range in size, but overall, they're going to be much smaller than fibroids. They're going to range in size from half a grain of rice, so super, super tiny, to about half the size of a golf ball. Now, symptoms of polyps primarily revolve around irregular bleeding. So maybe you're having irregular periods in terms of the timing. Maybe you're having your period every 2 to 3 weeks. Maybe you're bleeding between periods, spotting, or a little bit heavier. Maybe you're having just really heavy periods, but they're regular. Also, having bleeding after menopause can be a sign of polyps, and in general, infertility. And we'll talk about why that is, but it's not a guarantee. So I don't want you to hear this and think, oh my gosh, I know I have a polyp, I'm not going to be able to have kids. It is not that at all. Now, fibroids are more likely to be associated with pain and fatigue, whereas polyps are not. Polyps typically tend to be painless. Maybe depending on the size, you might have a little bit of pressure in your lower back, but they're not going to be as painful as fibroids. Now, the most concerning difference between fibroids and polyps is that polyps can become cancerous. So about 5% of polyps become precancerous in postmenopausal women, but only 1% become precancerous in premenopausal women. So the risk is very, very, very low. But if you have polyps, your doctor is likely going to say, okay, let's monitor that just to make sure it doesn't become precancerous. Very similar to, and I've talked about this before, but women with PCOS who don't have a period for months at a time are at an increased risk of developing endometrial hyperplasia. And this is when that endometrial tissue lining the uterus, it grows and grows and grows. And because we're not getting a period, that tissue isn't shedding and being broken down. And as a result, that abnormal growth leads to cellular changes, which can lead to cancer lining the uterus. So very similar to polyps, because with polyps, we're seeing that overgrowth of the endometrial tissue and it's not being shed, very similar to endometrial hyperplasia that we can see with PCOS. So some risk factors for polyps, one is going to be being in that perimenopause time period. So being in your 40s, obesity, high blood pressure, If you've taken drugs like tamoxifen, which is a drug for breast cancer, if you've taken hormone replacement therapy, specifically with estrogen, or if you've been on a combination birth control pill that includes estrogen, that can all increase your risk factor for polyps as well. And then genetics, unfortunately, like a lot of reproductive concerns, genetics do play a role. And if you have a mom, a grandmother, an aunt with lots of polyps, then you may expect to experience the same. Now, like I mentioned before, polyps can impact fertility, but not always. So one of the reasons for this is that polyps do take up space in the uterus. So they potentially could prevent the placenta from forming properly. They could potentially get in the way of implantation of that embryo, especially if you have many polyps. They also could potentially block the fallopian tube. So if you have a polyp blocking a fallopian tube and an egg is not able to travel from the ovary down the fallopian tube to the uterus, then you're not going to have that egg there to be fertilized, and you're not going to be able to have a pregnancy take place. Now, because we typically switch which ovary we ovulate from, if you have a polyp on one side that's blocking one fallopian tube, then perhaps, you're still able to get pregnant. It just might be every other cycle as you ovulate from that other side the following month. Oftentimes, women are able to have healthy pregnancies with polyps, and it is not a concern, but it's something that if you have polyps, your OB likely has spoken to you about. Now, the cause of polyps, similar to fibroids, is unclear, but it's suspected to have some sort of connection with high estrogen levels. So if you are thinking like, okay, I've never been diagnosed with polyps before, but it does sound like potentially I have it because I have really heavy periods, I bleed in between my periods, how do I find out if I have uterine polyps? So the first thing you would do is go to your OB. They would ask you some questions, just kind of asking you about the symptoms that I described today. And then they would likely do a pelvic exam where they just kind of feel for your uterus, feel for your ovaries. And then they would likely do an ultrasound as well to see if they can visualize some of the polyps. Now, if polyps are found, they may do a biopsy of the tissue just to determine if there are any sort of precancerous changes. That's typically what will be done in the conventional world. Now, when I work with patients on both fibroids and polyps, I typically recommend doing the Dutch test. The Dutch test is a urine hormone panel, and one of the primary things the Dutch test looks at that is really helpful from a fibroid polyp perspective is your estrogen levels. So if you've ever had your estrogen checked with your OB, they have likely tested something called estradiol, which is one type of estrogen. It's called E2, but we actually have 3 different types of estrogen in our body. So we have E1, E2, and an E3. And it's really important to consider the level of all of these estrogens because maybe your E2 is within a good range, but if your E1, your E3 is really through the roof high, which I have seen on panels before, then it's like, okay, we do need to do more support around lowering estrogen levels. There's also one specific type of estrogen, and this happens in the estrogen breakdown process that can sometimes increase the risk of fibroids and polyps growing. So if you tend to go down that pathway more than the others, then we might want to make some dietary changes and supplement changes to kind of push the estrogen away from that pathway. So that's really what I'm looking for on a Dutch test. That's the primary thing that I recommend testing with my patients who are addressing polyps, and then also considering inflammation. So we might look at cortisol levels, or that's our stress hormone. That's going to play a role with inflammation. And I also might look at something called CRP, which is essentially just a general marker for inflammation in the body. So that is kind of how you get diagnosed. Now, if you have polyps and you've been to your OB and you've been diagnosed, you probably have been told perhaps, okay, your polyps might resolve on its own. We'll just watch and wait for now. If your polyps are really problematic, if they are having really bad symptoms, your doctor may have recommended taking a progestin prescription, which is essentially a progesterone prescription. And that's going to help to prevent the lining of the uterus from growing too much. It's going to kind of help to counteract estrogen. and will help to at least prevent the growth of the polyps that are there. Now, when polyps are really problematic, then you may be recommended to have a uterine polypectomy, which I don't know why I love that word so much. But essentially that is the removal of the polyps. Now, it's unclear if removal of polyps really makes that much of a difference in fertility, especially if it's not confirmed that these polyps are impacting your fertility. So for example, if you're somebody who has 3 or 4 polyps, you're thinking about getting pregnant in 5 to 6 years, you've never tried to get pregnant, right now you have no reason to believe why you shouldn't be able to get pregnant other than the fact that you have these polyps. It's not necessarily going to be an automatic, okay, you need to get these removed before you get pregnant. It might just be let's see how the first few months of trying goes. Let's see if you potentially miscarry related to a polyp. But again, these polyps typically are much, much smaller than fibroids, so they are not impacting fertility as much. Also, once you do get that polypectomy, they aren't likely to grow back once removed, but it is possible, so you may need another surgery to remove them. So that is the conventional approach. Now, conventional medicine will say, there's nothing you can do at all to help reduce your risk of polyps growing. They'll say the same thing about fibroids, the same thing about endometriosis. I kind of look at those 3 conditions kind of under the same umbrella as each other, because essentially they're conditions that are related to tissue overgrowth in the uterus that are often impacting periods. So really what I'm focusing on when it comes to polyps, number 1 is balancing estrogen levels, making sure you're not estrogen dominant, which essentially means making sure your estrogen isn't too high, but also making sure your progesterone isn't too low. So ideally we want estrogen and progesterone balancing each other out. When we're in a state of estrogen dominance, sometimes that means estrogen is high, but progesterone is normal. It could mean estrogen is high and progesterone is really low, or it could mean estrogen is normal and progesterone is really low. I hope you followed that. I usually kind of show this explanation with my hands in a scale, but on the podcast it's hard to do. But essentially it's just some sort of imbalance of estrogen and progesterone with the scales tipped heavier towards estrogen. So that's one thing I definitely focus on. And the second is going to be to reduce inflammation. So that might be looking at, okay, what's happening in your lifestyle? It's causing inflammation. Are you drinking a lot? Are you not sleeping well? Are you doing HIIT? Are you a marathon runner? And then also looking at what foods could potentially be causing inflammation in your body as well. So if you have polyps, I want to share a few things that you can start either doing today or at least something to take to your doctor and discuss. But first is going to be diet. Diet, I always say, is number 1. If your diet isn't in a good place, it doesn't matter how many supplements you're taking, you're not going to see the improvement you're looking for. So in terms of food, we want to think about foods that can help support estrogen levels. The first is going to be cruciferous vegetables. So this is things like broccoli, cauliflower, kale, Brussels sprouts, mustard greens. These foods contain a compound called DIM, so DIM, and it helps your body break down estrogen. So if you have really high levels, it's going to help to break it down, but it also helps to send it towards the good pathway, away from that pathway that could potentially cause more polyp growth. So cruciferous veggies, I would say if you can, minimum having a cup a day, so either a cup at lunch, cup at dinner. An easy way to get them into a smoothie would be to throw in some frozen rice cauliflower into your smoothie. It just makes it a little bit thicker. Spinach is not included in this category, unfortunately, but arugula is. I don't make the rules. That's just how it is. So cruciferous veggies, and then ground flax seeds. So flax seeds help to bind up the estrogen in our gut and help to eliminate it through our stool. Now, some things to know about flax seeds. The first is that you want to make sure they're not rancid. So if you're thinking, oh, I think I have a bag of flax seeds, it's in my cupboard for 2 years, let me pull that out, I'd probably recommend starting fresh with some flax seeds. You want to make sure you're storing them in the fridge, because once they're ground up, those oils are being exposed, they're being oxidized. So you don't want them to go rancid, and keeping them in the fridge will help them stay longer. And then you want to make sure you're having the flax seeds ground. So ideally, if you can, grind them fresh. So maybe like once a week, maybe on a Sunday night, grind a bunch of flax seeds for that week, put it in your coffee grinder, and then store it in the fridge. If grinding your flax seeds is not going to happen, then you can buy them pre-ground. But just in general, you don't want to be eating the whole flax seeds because those have a thick, waxy coating, and you're really not going to get the benefits of the binding the estrogen with that waxy coat on. So they're just going to kind of go right through you. So those are really the top two food groups for balancing estrogen. For reducing inflammation, fatty fish like salmon and trout can be really great. Also, including foods like berries that are high in antioxidants can help to prevent DNA damage. And then also thinking of high fiber foods to help eliminate that estrogen. So whole grains like oats, quinoa, brown rice are really great. And, none of these foods are unicorn foods. They're usually, they're pretty straightforward. If you're eating a well-balanced diet, you're probably getting most of these foods already. The one exception might be the ground flax seeds that you have to think about adding in. And, adding in flax seeds, you can add it to your smoothie, your oatmeal, yogurt. Some patients will add it just to a little bit of water and take it like a shot. I am not in that camp. I cannot do it. The texture freaks me out, but if you can, power to you. So those are the foods that I would prioritize. Now, when we're thinking of foods that we want to limit, and, we don't have to be 100% black and white, can never touch these foods, but in general, trying to limit red meat, gluten if you're sensitive to it. So just identifying what foods tend to cause inflammation in your body. Sugar, we know that tends to be inflammatory for everyone. Alcohol as well, because alcohol is not only going to cause inflammation in our body, but it's also going to impact our liver health. And the liver is where estrogen is broken down. So if we're drinking, even a couple of drinks a week, and our liver is having to focus on breaking down the alcohol, estrogen is going to get put on the back burner, and over time, estrogen levels are going to increase. And then also wanting to think about how can you cut back on caffeine. So again, you don't have to completely cut it out cold turkey. Maybe if you're somebody who has an 8 a.m. cup of coffee and a 10 a.m. cup of coffee, maybe we cut out the 10 a.m. and over time work towards half decaf in the morning. Don't kill me for saying that. But that's because with caffeine, and especially when we're drinking it often or if we're drinking on empty stomach, that is going to cause our cortisol, our stress hormone, to spike, and that is going to contribute to inflammation as well. So foods we want to eat more of: cruciferous veggies, flax seeds, fatty fish, berries, and whole grains. Foods we want to limit, but not necessarily 100% avoid, is red meat, gluten, sugar, alcohol, and caffeine. Now, I know on the podcast, I often say I don't love talking about supplements on here because they're so individual and specific. And I'm going to preface this by saying this is just educational. Make sure you talk to your doctor before starting any new supplement. But I do want to share a few here that I have found to be really, really helpful. And the first is DIM. So DIM, I had mentioned that when we talked about the cruciferous veggies, and you can actually take this in supplement form as well, which will really be a higher dose than what you're getting through food. And DIM is going to help with that estrogen balance. Now, most supplements, especially when we're talking about seeing shifts in hormones, it's going to take a solid 3 months. So if you take DIM for 2 weeks and then you get your period and it's unchanged, don't get frustrated because you just haven't given it enough time. Take the DIM for 3 months and then assess how your periods are doing. I'm apprehensive to just say to start taking DIM blindly, because I have had some patients who have been taking DIM and then we test their estrogen is actually completely like bottomed out so low, and the DIM is only making that worse. Now, in their case, they didn't have fibroids or polyps. So it's a little bit safer if you have those polyps, because it's a little bit more likely you do have some sort of estrogen dominance. But I really believe in testing first before taking a supplement that is really specific for such a certain hormone imbalance. Also, fish oil, really great for reducing inflammation. I am very, very, very particular on fish oil brands, though. If you're taking the Costco fish oil, I recommend against it. A lot of times fish oil are cross-contaminated with heavy metals. So if you're taking a low quality fish oil that is contaminated, it's almost worse than just not taking the fish oil to begin with. So I really love the brand Nordic Naturals. That's one that's pretty popular, and you can find that even in stores. But if you have kind of similar to flax seeds, if you have a fish oil that's been sitting in your cabinet for years and you're thinking, great, I'm gonna go dig that out, it's probably rancid, it's probably bad by now, and you're probably better off just tossing it and starting fresh. Vitamin B6, really great for supporting progesterone balance. So if you have any sort of estrogen dominance where your progesterone is really low and in relation to your estrogen being really high, B6 can help to bring those hormones back into balance. And the last one I'll mention is glutathione. So glutathione is a really, really potent antioxidant in the body. It's really great for supporting liver health. So if you're somebody who, struggles with, maybe you have high estrogen, you were on the birth control pill for 10 plus years, maybe you're in your late 20s and you're thinking back to your college days of, drinking a lot in college, and your liver just needs more support post all of that, glutathione could be a good option to take for a few months to help support that. All right, lastly, just some lifestyle changes to think about if you do have polyps. This one I already kind of mentioned, cutting back on alcohol and caffeine where you can. And, you don't have to have this all or nothing mentality. You don't have to think, okay, I have to be 100% sober and can never touch a cup of coffee for the rest of my life. It's not about that. It's just about, reducing where you can. So maybe you don't drink during the week, but you have drinks with friends on Saturday night. Maybe you don't, have that second cup of coffee, or maybe you just have coffee on, holidays or on vacation or like on special occasions. So, still finding that balance and allowing yourself to live your life and not being so strict with yourself on it, but just knowing that any small change you make over time, it will add up and it will make a difference. Also, limiting chemicals in personal care products. So I have talked about this quite a bit, I think, on the podcast, but there are chemicals in our environment called xenoestrogens. Xenoestrogens are chemicals that mimic estrogen in our body. So these are found in shampoo, conditioner, body wash, toothpaste, sunscreen, cleaning products, you name it, and a xenoestrogen is likely in it, or cookware. So are we going to be 100% non-toxic in every aspect of our life? Absolutely not. But maybe next time you go to the store and you're due to get a new sunscreen, maybe that's your time to say, okay, maybe could I find a cleaner option? And if you haven't already, download the Environmental Working Group's Healthy Living app. It's called Healthy Living. It'll be a green box, I believe, with like a white E, kind of like a swirl as its logo. And this will allow you, when you go to the store, you can scan a barcode on a product and it will give you a rating from 1 to 10, 10 being the most toxic, 1 being the least. So really, really helpful. You don't have to read labels. You don't have to guess what ingredients are good and what aren't. The Environmental Working Group has done that for you. So I recommend, just as you're due to replace your products, just scan what you had. Once you run out of it, don't scan it now, because it may make you want to throw it away, and there's no need to waste all these products, but scan it when you run out. And then maybe if that one ranks high, next time you go to the store, find one that ranks lower. And the last one, which may be controversial, but I'll end it on this, is get off oral birth control pills. So you may have experience, if you have endometriosis, PCOS, fibroids, polyps, really anything gynecologic related, the birth control pill is sold to us as this magic solution, when more often than not, it is contributing to the problem. So if you're on the pill, maybe you're afraid to get off the pill because you're afraid that your really heavy periods will come back, then working with somebody like me or someone who does something similar to what I do to kind of do preparation for a month or two before getting off the pill, and then your body will be in a better place to transition off. But in the long run, you will be better off for it, that you're not taking these synthetic hormones that are only contributing to the polyp growth or the fibroid growth or the endometriosis growth. So if you are afraid to, know that you don't have to do it alone. There is support out there for you, and just making sure you have that support so you can navigate off of it without having your symptoms come back potentially worse than they were when you first started on the birth control pill. All right, that is all I have for you today related to polyps. I hope that was helpful. If you have any questions on anything I spoke about today, if you have any topic requests, I love to get them. So don't hesitate to DM me at Dr. Danielle _ND, or you can shoot me an email on at info@drdaniellederoche.com. Thank you so much for listening. Make sure you follow so you are alerted when new episodes come out every Tuesday and Friday. And I will see you later in the week for our Friday Chats episode.